mucopurulent carcinoma. In pediatric age group, we see mucopurulent carcinoma. In adult, we see a pleomorphic Wharton tumor. In adult, we see Wharton tumor. In pediatric, we see mucopurulent carcinoma. 9. Primary hyperparathyroidism characterized by T is greater than E. Subparasitary resorption seen in 50% case is the best answer. And combination clinical presentation between electron and software investigation. So primary hyperthyroidism characterized by subparasitary resorption seen in 50% of cases. Number for primary hyperthyroidism, PBC, brown tumor, P for brown tumor, and C for chondrocalcinosis. So primary hyperthyroidism has brown tumor and chondrocalcinosis. But it is characterized by most likely subparasitary resorption in 50% of cases. If there is not an option, then combination clinical presentation with electron and software investigation. 10% of mortality in year 24 of aortic dissection is C25%. C25%. Percentage of mortality in year 24 of aortic dissection is C25%. Then a 35-year-old female presents with hoarseness, hemoptysis, and stridor series with stridor stenosis and multiple nodules bilaterally and superior location, some of which was speculated margins and some are cavitating, with most likely diagnosed vaginal granulomatosis. 35-year-old female with hoarseness, hemoptysis, and stridor series with stridor stenosis, multiple nodules bilaterally and superior location, some of which shows speculated margins and some are cavitating, most likely diagnosed vaginal granulomatosis. 12. Double density sign on bone scan feature of osteoid osteoma. 13. Soft tissue mass appearing hypertension on both T1 and T2 with MR images diagnosed will eliminate fibrocystic or fibrosarcoma. Melanoma. Soft tissue mass appearing hypertension on both T1 and T2, hypertension on T1, melanoma. Hypertension on both T1 and T2 diagnosed melanoma. Soft tissue mass appearing hypertension on T1 and T2, melanoma. 14. T2 hypertension signals seen in binary globus paradigm, what is diagnosed carbon monoxide poisoning. T2 hypertension signal in binary globus paradigm seen in carbon monoxide poisoning, and in methanol poisoning, putamen is involved. Hypertension signal in both putamen, there is methanol poisoning, and binary globus paradigm and carbon monoxide poisoning. Scenario of Danny Walker malformation on episodic ultrasound. Okay, so there will be enlarged posterior fossa, vermin hypoplasia, absence of carpusculosis. 19. In anterior ultrasound, echogenic mass seen posteriorly in the fetal chest and displaying heart anteriorly was diagnosed diaphragmatic hernia. And then ultrasound echogenic mass seen posteriorly in the fetal chest and displaying heart anteriorly was diagnosed diaphragmatic hernia. 17. Urothelial carcinoma associated with operation or exposure of aromatic compound. Urothelial carcinoma associated with operation or exposure of aromatic compound. 18. Urothelial carcinoma, urethral cancer are bilateral in 25% of cases. D. Urothelial carcinoma, urethral cancer are bilateral in 25% of cases. Other MCQs show CD cannot differentiate between T1 and T3A. And aromatic compounds that causes urethral called bladder carcinoma, and this one shows urothelial carcinoma cancers are bilateral and 25% cases. 19. General compression fracture of pelvis is characterized by type T as contralateral shift of acetabular pelvis. General compression fracture of pelvis is characterized by type T as contralateral shift of acetabular or pelvis. 20. Acetabular fracture of pelvis is detected by CT scan. 20. And shoulder by MRI. Acetabular fractures are best detected by CT scan. Acetabular fractures, CT scan, and shoulder fractures are best detected by MRI. 21. Evolution fracture with bone site and muscle wall, ellipsoid and lesser trochanter. Evolution fracture, ellipsoid and lesser trochanter. 22. Fibrolaminar carcinoma scenario, FRCR book, is sectoral scar with hypointense on T1 and T2. Fibrolaminar carcinoma scenario in FRCR book, sectoral scar hypointense on T1 and T2. 23. Hepatic adenoma scenario, FRCR book, hyper on T1. Also, or contraceptive use and subcapsular is hepatic adenoma and hyper-T1. I think it's hypo and hinges on arterial fill. It is variable on T1 and hyper on T2 also. So here hyper on T1 is all correct. 24. Pregnant female focal nerve hyperplasia scenario about your book. Hyper on T2 central scar because of fat. Focal nerve hyperplasia is hyper on T2 central scar because of fat. 25. Known case of VHL, there is multicystic. Repeat question. Known case of VHL, there is multicystic hyperdense mass with bunch of grapes appearance in central scar seen in necropancreas, most likely diagnosed. Serous cysternoma. 26. MRCP shows extrinsic component on mid-common hepatic duct or CVD with filling defect in cystic duct, or is like diagnosed Mersey syndrome. Filling defect in cystic duct, Mersey syndrome. Present scenario with CT features such as ampullary mass, which investigation best for local staining and scope for ultrasound. Ampullary mass in pancreas, local staining is endoscope for ultrasound. 28. 25-year-old presents with headache and BP of 180 by 110. Shows very aneurysm of MCM. What will be the most likely location of hemorrhage? Subneck cases. In hemorrhage, the aneurysm of MCM most likely leukemia hemorrhage, subarachnoid space, so causing subarachnoid hemorrhage. 29. Scenario NF1, bilateral dumbbell-shaped mass with spinal cord, causing expansion of nerve formula. 30. In liver transplant patient, LFT drained for after 24 hours of transplant. What is most likely cause? Hepatic artery thrombosis. In liver transplant, LFT drained after 24 hours of transplant, most likely cause hepatic artery thrombosis. 31. Mistake lesion in the liver from GIT, serum and right portal vein embolization. What is most likely reason for that? To reduce bulk or size of tumor. 32. Female parent present with melanina for 6 months. Colonoscopy is normal. CT is the CT shows well-defined luminant hyperdense lesion in the jejunum. What is like diagnosis? Tumor myoma. Because well-defined lesion in the jejunum and then she had melanina, so diagnosed myoma. 33. On antenatal ultrasound, multiple renal cysts are noted. What is the likely finding on MRI/fetal MRI? Occipital encephalocele, because the diagnosis is Meckel-Gruber syndrome. Meckel-Gruber syndrome, which is multiple renal cyst, occipital encephalocele, and post-axial polydactyly. So on antenatal ultrasound, the multiple renal cysts are noted. There is finding on MRI brain, occipital encephalocele. That will be encephalocele and the occipital region. So 34. Regarding neonatal / congenital multicystic kidneys, renal pelvis / contrast pelvis is not required. Multicystic kidneys, because there is no function on the kidney. 35. Regarding platelet, degenerative calcification of vessel wall. Platelet is degenerative calcification of vessel wall. 36. Patient presents with postural headache, scenario choleritis. Scenario choleritis is there is a cyst in form of Monroe. In form of Monroe, we see two things: choleritis or giant cell astrocytoma. In form of Monroe, we see two lesions, either choleritis or giant cell astrocytoma. Choleritis will most likely cause postural headache. Giant cell astrocytoma will be another sign of it. But in form of Monroe, we see two lesions, choleritis and giant cell astrocytoma. 37. Ectopic pregnancy scenario from about book. 38. Scenario of dual arteriovenous malformation of total number spine in elderly patient. 39. Breast pathology in diabetic patient appearing as stellate mass. Lesion / mass is speculated margin on mammography that does not attain appearance in 2 years. This is considered, is called as diabetic myopathy. We see diabetic patient to diabetic myopathy, and it has no change in 2 years. Carcinoma will show change in 2 years. It cannot be carcinoma because there is no diagnosis in 2 years, so diagnosis is diabetic myopathy. Diabetic myopathy is seen in diabetic patient and it shows no change in 2 years. 40. Intracranial hemorrhage on CT scan having 70 SU value and shows fluid level. What is likely age of hemorrhage? 3 to 48 hours. Now memorize this as it is. In 2 to 3 hours, hospital unit, 4 to 6 days. And 3 to 48 hours, 60 to 80 hospital unit. And 3 to 7 days, high center and low center periphery. And low hospital unit periphery. And 7 to 30 days or 2 to 4 weeks, there's low center, hyperdense center, but high periphery, high single periphery. It is also called chronic. Now, 2 to 3 hours is called hyperacute, and 3 to 48 hours is called acute, and 3 to 7 days is called subacute, and then 7 to 30 days is called chronic. So memorize these. 4 to 60, 60 to 80, and then high center and hypotenuse peripheral, and low center and hypertense peripheral. 41. Renal artery stenosis and capillary syndrome characterized by GFR, so renal function decrease. 42. Coronal artery stenosis shows multiple tiny echogenic areas without shattering. Left atrial macrolithiasis is associated with seminoma. Now, memorize MI findings. I bleed 1 to 3 hours. I die up to 24 hours. I bleed die 3 to 7 days. Bleed 7 to 14 days, and die more than 14 days. Yeah, subacute, acute, I can't remember, but memorized mnemonic. Superior vena cava syndrome most commonly caused by which of the following? Small cell carcinoma. Superior vena cava syndrome most commonly caused by which of the following? Small cell carcinoma. Reason is because it is not like Pancoast tumor, seen in Wikipedia. Correct? Superior vena cava syndrome most commonly caused by small cell carcinoma. And Pancoast tumor is caused by squamous cell carcinoma. So memorize this. Superior vena cava syndrome most commonly caused by small cell carcinoma. Therefore, which is characteristic feature of tuberous sclerosis? Calcified subependymal and cortical tubers. Characteristic feature of tuberous sclerosis: calcified subependymal and cortical tubers. 45. True about GI contrast studies. Coiled spring appearance seen in reception on anti-record studies. Coiled spring appearance seen in reception. Please repeat or MCQ. 46. Female parent comes for cheat of down due to complaint of abnormal pain and sweating. She develops headache, palpitation, and raised BP 180 by 110. About 15 minutes after contrast CT.